This is the story of the time that I got pregnant when I was already pregnant. Let's talk about it. A couple years ago, I was finishing my doctorate in occupational therapy. I was set to graduate in May of 2022. My husband and I had agreed that we would try to time a baby for a couple of months after graduation. It would work perfectly if I graduated in May, could take my licensing exam, and then have a baby in like July, or so we thought. We decided that we would start trying in October. Around the time that my next cycle was due, I started having some symptoms that made us think that I was pregnant. However, when my period was due, I started having some spotting, so I felt like my period was going to start. But that month, my period never really picked up. I was having a lot of spotting, and so I did take a test, which came out positive. I decided to wait a couple of days and just see if the spotting had stopped, which it never did. So about a week later, I called my OB, very concerned that I was having an ectopic pregnancy, and they shared my concerns and had me come in early for an ultrasound. I was seen around 6 weeks. When I got to the office, I was super nervous that it was going to be an ectopic pregnancy. On the ultrasound, it showed one healthy baby with a beautiful heartbeat. After the ultrasound technician showed us the first baby's heartbeat, she left the room and the nurse practitioner came back into the room. She said everything looked great. At the very end of the appointment, she said, we did see a little blip on the ultrasound that may have been a second gestational sac. If it was even a gestational sac, it was empty, there's nothing in there. At this point, there should be a heartbeat, and so we expect that it is a blighted ovum or a vanishing twin, a pregnancy that started out as a twin pregnancy and is not continuing that way. At that appointment, I even said, is there any chance at this point that that sac develops into a second baby? And the nurse practitioner said, highly unlikely. I'm running out of time, so I'm gonna have to make this a part 2.